This is a presentation on Getting Australia Active 3 by ASAPa, the Australian Systems Approaches to Physical Activity. The presentation is about how this is of direct relevance to this. GAA3 is comprehensive and is of direct relevance to Western Sydney moving. It's a robust report which we shouldn't ignore, nor should we try to reinvent it. Rather, we should adapt it as required to suit the local context of Western Sydney, its people, its organisations, places, spaces and services. There are lessons and principles to learn from past successes and failures. We'll explore those. In Western Sydney moving, there are great assets and opportunities which can make a difference, a positive difference to the lives of community members. And there are co-benefits for the agencies and organisations involved in making Western Sydney a more active community. This is the route map for our presentation. An introduction to GAA, exploration of the 8 domains for action, the main content areas of the report, the co-benefits and best investments for the partners, and learning from past experience. Getting Australia Active 3 is the first comprehensive guide on a whole-of systems approach to physical activity in the world. Although it's the first in the world, it's not the first in Australia. This report has a 25-year lineage, so from 1996 onwards, these 5 reports have all come from 2 of our team members in common, Adrian Bauman and Bellew. So we have a strong track record and a deep understanding of this area of multi-sectoral approaches to physical activity. What's new is the focus in whole of systems approaches. There are 8 domains for action, sometimes referred to as the 8 best investments in physical activity. There are really 8 policy domains for action, and there are investments within those policy domains. These are education, transport, the built environment, primary and secondary healthcare, communication, all of community approaches, workplaces, and sport and recreation. The full report GAA3 may be accessed on this website. The main content areas of GAA3 can be summarized as the case for physical activity, an overview and rationale for a whole of systems approach, the policy domains for action, addressing inequity, and dealing with physical activity surveillance. This surveillance at a systems level, more than just looking at individual behaviours, it's about also organisations, settings and sectors, and their relationships in the physical activity system over time. More than just measuring an individual's physical activity, we want to see how policies are implemented and how organisations may be adapting and changing over time. GAA3 is available in downloadable sections. The report is large, You might be interested most in Chapter 3, Policy Domains for Action, where those 8 domains are discussed in detail. But there is also a summary version of the report, which explores the 8 domains in detail. These are summary briefs, which are short, succinct, user-friendly versions of the report. There are co-benefits for partner organisations in an endeavour such as Western Sydney Moving. The benefits can be described in terms of economic, health, social and environmental outputs. For example, in the economic domain, reduced healthcare costs and productivity losses will be of great interest to Treasury. From a health perspective, healthy ageing and delayed cognitive decline in older adults brings many benefits. In the social domain, academic performance in children and potential role for sport in crime reduction are of great value at a societal level. And from the environmental point of view, reduced carbon emissions and improved air quality are clearly important at a whole society level. Let's look at health and aged care. Every day, 364 Australians have a fall that puts them in hospital. It's almost 365 by 365, and every day 14 will die from a fall. These falls cost 2.5 billion each year to our health systems. Yet 1/3 of these falls can be prevented. And one of the keys to prevention is through physical activity. It requires government policy, investment, community-wide action and coordination across all of these, so joined up efforts. But the prevention of 1/3 of these falls can be undertaken through a balance and strength exercise approach 2 to 3 times a week. Thinking about those costs in excess of 2 billion, it's great to think about preventing 1/3 of those falls. This is just one small aspect of the co-benefits. So at the high level, what are the recommendations for investment in action? Well, a multi-sectoral or societal perspective is important. A systems science approach brings many benefits in thinking about joined up action. We shouldn't wait for dynamic simulation modeling before we take action, but if we're able to look at dynamic simulation, it can bring very great benefits in terms of understanding the best impacts and the multiplication effects of some of our programs, services and interventions. A whole of government investment strategy is important. In terms of investment, we are advised to focus on those who are currently least active. This is where the greatest benefits will accrue. And we need to think about the life course when considering investment, right across from youngsters through to older adults, as we've just seen in terms of falls prevention. Physical activity, like people, comes in all shapes and sizes, and they're different at different life stages. So what's appropriate for children will be different from what's appropriate for teenagers and for older adults. In more detailed look at these domains, there are specific recommendations for action. We don't have time in this short presentation to drill into these, but they are available in terms of the summary briefs, which everybody should receive a copy of, and of course they're available on the website which was provided earlier. We can learn from past experience, and we can think about the hardwired policy criteria. On the left you can see a paper, The Rise and Fall of Australian Physical Activity Policy, over a 10-year period. It was a national review framed in an international context, written by myself, Stephanie Schupper, Fiona Bull, now at the World Health Organization, and Professor Adrian Bauman. Hardwired stands for highly consultative in development, active through multi-strategic, multi-level partnerships, resourced adequately, developed in standalone and synergistic policy modes. Let's pause and explain that one. It means that we can have single strategies joined up on physical activity, but we can also have the web of physical activity, a thread through all policies that might not have physical activity as their title, yet physical activity is within them. It might be about crime reduction, for example, or community safety, or about mental health, but the thread of physical activity can be there. So we need to make sure that we have a physical activity strategy, but also that the thread of physical activity runs through many other relevant policies. Widely communicated, one of the things here is the benefit of a common logo, so that we can badge our activities across the partnership and get recognition that is of benefit to promoting our messages. Independently evaluated, role clarified and performance delineated. What does that mean? It means we're clear about the roles of the different agencies, who does what. We don't duplicate, we don't leave gaps. And performance delineated means we have indicators as to what success looks like, and we are able to report on those. We are able to do so in a transparent way, in a way that's accountable to our stakeholders and to the community. We are both evidence informed in terms of the way we develop our strategies, and evidence generating because we are evaluating what we do and building on previous knowledge. And not last but not least, we have defined national guidelines for health enhancing physical activity, and so we will use those to inform the way our policies are framed and designed. So these hardwired criteria, you can tell from the sound of it, if we use them, we're more likely to have sustained efforts because the policies become hardwired into our institutions. So, how have we done in these? Well, the review found that across Australia and several other countries, we have done well overall, but we have some weaknesses. We're not so good at resourcing adequately. We're not so good at independent evaluation. And we could do much better at role clarification and performance delineation. These are things to watch out for, pitfalls to avoid for Western Sydney active, Western Sydney moving. So this is where we've been. This is where the presenter tells you what he's told you. We've looked at GAA 3, we've noted 8 domains for action, we've looked at content areas at a glance, we've talked about co-benefits and best investments, and we've noted some things to learn from the past, some pitfalls to avoid. These were our key messages. Let's not duplicate GAA 3, let's adapt it. Let's learn those lessons from the past. Let's recognise the assets and opportunities for Western Sydney moving and harness them. And let's recognise the many co-benefits of a focus on physical activity for the agencies and organisations involved in Western Sydney moving. We'd like to acknowledge our funding partners. This work has been supported by the Australian Government's Medical Research Future Fund, and the Australian Prevention Partnership Centre is funded by the National Health and Medical Research Council. Thank you for your attention. On behalf of Tracy Nau, Adrian Bauman, Ben Smith, and myself, Professor Bill Bellew.